The following is a project of our nonprofit newsroom. Support Midcoast Morning and local community-centered journalism today by signing up to be a monthly sustaining donor at chly.ca/donate. It doesn't take much money to support local news.
Hello and welcome to Midcoast Morning. I'm Joe Pugh. Labour leaders were in Nanaimo this week looking to put a spotlight on healthcare in this federal election. The presidents of the Canadian Labour Congress and the Hospital Employees Union spoke to media outside of Nanaimo Regional General Hospital on Monday. On today's program, we're going to hear some of their concerns and then break down the role of the federal government in healthcare and some of the issues impacting our system nationwide. Here's Canadian Labour Congress President Bea Bresk speaking with me Monday. What brought you out to Nanaimo this morning?
So what brought us out to Nanaimo this morning was to really talk about healthcare and to make sure that healthcare is on not just people's minds, but on the elected officials and those who want to be elected minds. Because certainly when I've been talking to various different workers across the country, when I'm talking to individuals on the doorstep, what I hear about is healthcare, and yet the federal party leaders have spent very little time on the healthcare issue. You know, as Canadians, it's one of our proudest accomplishments to say that we have a national healthcare system and that people don't have to take out a mortgage to get an operation like we see in the States, right? But at the same time, our healthcare system is crumbling at this moment in time. I think any of us who've had to access healthcare most recently will understand that the wait times are very long, that we have an aging population, that we have a recruitment and retention issue of healthcare workers, whether you're a nurse or a doctor, or whether you're working as a professional technical person, whether you're working in a lab, whether you're an x-ray tech, whether you are helping individuals learn how to walk again, or whether you're providing support services and providing meals to patients. Everybody is stretched to the max. Everybody is tired. Everybody's doing so many shifts, so much overtime. They're bearing the burden of people's frustration because they're working on the front line. So when people are angry because they can't get the care that they need or their loved ones can't get the care that they need, they turn and take their frustration out on the very healthcare workers that we rely on. And so we need a significant investment in our healthcare system. We need to actually find a solution to the human health resource crisis in terms of making sure that we have enough staff coming into the system based on the fact that we have an aging population, that we can keep the staff that we have and that we don't lose them to private sector initiatives, right? And that we build up and bulk up the staffing levels that we have.
Do you have that solution that you talked about? We need to find a solution to these issues. What do you think that solution is?
Yeah, so there's not one magic piece to that solution. It means bringing all parties to the table. That's different levels of government. That's our federal government providing some funding. That's our provincial governments allocating that funding properly to go to the very services that we need. That's bringing unions and workers to the table. And it means actually discussing what's at stake out there right now. Too often workers aren't asked what the solutions are. Too often workers are told, oh, we did a study and this is what the solution is. And workers could have told you 8 months ago that that's not going to work in this particular geographic location or in this particular facility or with this particular type of patient with these particular issues. Too often workers are left out of the consultation to actually provide the solutions that they need. And when we look at the Canadian Federation of Union Nurses, when we look at even HEU here and many other unions across the country, they have solutions. They've talked to their workers. They know what those initiatives need to be. They know where the supports need to be. They talk to the families. They're consumers of healthcare themselves, right? And too often we're left out of those debates and discussions. But what I'm seeing right now is that there isn't a national focus on our healthcare system. And I appreciate that there's lots going on with Trump tariff issues, and we hear and we see the threats to jobs, and we're very much on that focus as well in terms of pushing back and making sure that we can stand up for good family and community supporting jobs. But we can't forget about healthcare in the meantime. It's too critical.
Also speaking Monday in Nanaimo was Hospital Employees Union President Barb Netterpel.
We're deeply concerned that in the only English debate that is going to be happening with the national leaders, that healthcare is not even going to be spoken about.
I'm going to come at you with the classic line, oh, healthcare is a provincial jurisdiction. It's a provincial responsibility. What's the response? Why is that not the thing to say in this circumstance?
Because it's the Canada Health Act that we need to uphold. It's the Canada Health Act that ensures that we have public, universal, accessible, portable health care. It's fundamental that every single Canadian has the right to have access to health care. The federal government is also responsible for paying for part of that. Back in the good old days, where the federal government would actually share the costs with the provinces. Between the Liberals and the Conservatives, cuts after cuts after cuts, that has gone down dramatically. The portion that the federal government pays into the provincial coffers for healthcare.
This morning, you were talking a lot about the idea of privatization. I'm wondering if you can explain to me what that means, like a concrete example of a way that privatization you feel is creeping into our health system.
So depending on where you are in the country, you're going to find various types of privatization within the acute care system. We have, for example, here, the lab services are privatized in the community. You can access public lab services in hospitals. But I would have to say that most of the privatization that you'll see is actually in the long-term care system. And I'll give you an example where, because of the fragmentation and the privatization of long-term care here in BC during the BC Liberal era, that the discrepancies between the working and caring conditions between a private facility and a public facility is as much as $7 an hour. The benefits are dramatically different, and pension to no pension. So if I'm a worker, a long-term care worker, a care aide, I'm going to pick to the place that's like one block down the road, and I'm going to work where I'm going to get paid and respected much better. So that's the crisis that ends up happening. Here in BC, during COVID, our government worked very hard, along with our union and other unions, to ensure that those wages were leveled up. So it didn't matter where you worked in the system, everybody gets paid the same. And that was to ensure that people didn't have the economic impacts of the single site order. It was the only jurisdiction in this country that did it. Other areas, if you look at the mortality rate in Quebec and in Ontario, it was devastating. There were entire long-term care facilities that were privatized where the workers completely vacated.
Barb Netterpel is president of the Hospital Employees Union.
Midcoast Morning is made possible by the Community Radio Fund of Canada and generous listeners like you. With your support, we can expand Midcoast Morning from 2 to 3 original programs per week to cover local news, current affairs, and arts and culture.
We're talking healthcare, the federal government, and the election on today's program. Labor leaders were in Nanaimo this week calling for more of a focus on healthcare in the campaign. Catherine Furlbeck has been researching healthcare policy for decades. Some of her more recent work includes an in-depth look at privatization in the Canadian system. I reached her in Halifax.
My name is Catherine Furlbeck. I live in Halifax, Nova Scotia, and I am a professor of political science specializing in health policy at Dalhousie University.
What are the big high-level things that people need to understand about the federal government and healthcare in Canada?
Right. So the fundamental tension that shapes everything in Canadian healthcare is the fact that the provinces have most of the constitutional authority to run healthcare, while Ottawa has the deeper pockets to help them pay for it. Now, most provinces couldn't afford as much public health care as they have now without federal funding. So I think that federal money accounts for about 22% of BC's healthcare expenditure, for example. At the same time, Ottawa wants to be able to put certain conditions on this funding, essentially, what's set out in the Canada Health Act, which is largely an undertaking to ensure that people can access health care on the basis of need rather than ability to pay. So for a few decades, this balancing act seemed to work relatively well, but then, as these things do, the world kept changing while the federal legislation stayed the same, which is why the Canada Health Act is increasingly unable to contain the tensions of privatization that have been emerging.
And you have spent time researching privatization in the Canadian healthcare system. Maybe before we get really far into it, what kind of context do you think it's important people know about, like, when we hear the words privatization in Canadian healthcare? What does that look like? What does that mean?
Okay. So Privatization can mean a number of different things. So you can have doctors providing cosmetic surgery privately, and that's fine. Nobody cares because when you talk about privatization, we largely focus on insured services, things, medically necessary services that we expect the government to cover. And so that's one issue. And the other issue is the extent to which provinces should be able to contract with private groups, say of surgeons, to set up shop, so that they essentially are contracting out the services rather than paying for them within the public system per se. And the thing, most provinces do this already. But the issue here is that patients are not expected to pay for these services when they receive them. So when you have a private surgical firm contracting with the provincial government, for example, patients don't really notice this because they still present their health insurance card and they take their time in the queue and they get their service done, and then the organization will bill the government. So most provinces already do this. There are pros and cons. But the big issue, of course, is whether and the extent to which and the conditions under which patients can or should be able to or should not be able to buy services that are also available within the public system and which the province promises to cover publicly. So there's at least three different streams of what we mean by private healthcare.
On that last one, can you give me some examples of the ways that that might have started happening, that people might be presented with the option to pay for things that the Canada Health Act, the provincial government ostensibly is supposed to give them access to without them having to pay?
Right. So again, you have to remember that the Canada Health Act does not forbid private healthcare per se. So where it gets particular is in the private provision of insured services. So again, it doesn't care about doctors providing cosmetic surgery because they're not insured services. So a lot here rests on what is meant by insured services. And if I can step back and look at the historical picture, because it's really important in understanding how we got to this position. So it's useful to understand that there was a particular context in which Medicare in Canada evolved, and that, of course, as we know, it was Saskatchewan in the early 1960s. So when Saskatchewan tried to implement Medicare in 1962, doctors staged a very acrimonious 3-week strike, which led the province to agree to carve out space for doctors to practice privately if they wanted to. And what happened is that most provinces followed suit as they enacted Medicare. And in fact, in some provinces like, New Brunswick, for example, they've articulated in their health legislation the right of physicians to work outside of the public system. So what provinces did in order to constrain the number of doctors working privately was to impose specific conditions on private practice. So some provinces, for example, said, if you practice privately, we'll still reimburse your patients, but only up to the level of the public fee schedules. So Nova Scotia, for example, does that. Or you can charge whatever you want, but we won't reimburse your patients. And that's the case in legislation for Alberta and New Brunswick. BC permits both options, but Ontario allows neither. So whether and how doctors can practice privately really varies a lot across provinces, which is one reason this is also confusing. Now, the thing is that the constraints on private practice rested in most provinces on the fact that it was economically unattractive to do so. Like, why would patients pay more for services that they could easily get free at point of care? And why would doctors work in the private sector if they were essentially paid the same rates as those in the public sector? But of course, once primary health care became a scarce resource, people, unsurprisingly, became more willing to pay for it. And the private model has become much more economically viable. In most provinces, it's always been legal in some way or shape or form, but now it's becoming much more viable. And we can certainly see this in Quebec with over 800 doctors practicing privately. So this is why we now see so much more private healthcare. That's to say, being able to buy insured services privately, despite the Canada Health Act.
What does that look like for me as someone looking to get healthcare? When you say that there's an increasing amount of private healthcare available to me, if I'm accessing that, what happens? What do I have to pay?
Right. And the answer is always is it depends. So again, let's step back for a second, and it's important to understand why it is that you are in a situation where you may be looking for private healthcare, right? Um, so when I was your age, lo, these several decades ago, it wouldn't have been an issue. I just find a doctor, I go to the doctor, and that would be that. But of course, over the past few decades, the population has grown larger, the population has grown older. The older demographic normally has more comorbidities, more conditions, which take more time to go through. The nature of healthcare is different. We have more treatments and more diagnostics. So if I'm 85 years old, not only do I have a lot of conditions, but each of those conditions can be treated in a number of different ways. And there are a number of different tests that I can do to figure out both what kind of illness I have and also which kind of medication would best treat that. So it's a lot more complex. There's more we can do. But of course, all this is going to cost more. Um, it's important to understand that the composition of healthcare providers has also changed considerably. We have more healthcare professions, right? There's something now called a physician assistant or prescribing nurse that we never had before. But not only that, but for the existing professions, they are experiencing widening scopes of practice. And of course, most specifically, nurse practitioners can provide pretty much the same basic services that GPs can provide, depending on the province. And also for various reasons, med students are less interested in becoming GPs, so that squeezes the pool of providers available. And then, of course, there's a possibility of poaching healthcare providers across provinces, right? If you're willing to pay more than other provinces. So, all of this puts a squeeze on what's available publicly. And then there's the issue that where and how healthcare is provided also has changed, right? It's not just in hospitals and GP offices, but also virtually, for example, or even out of province. So, all of this serves to um, create the condition where you're looking for a primary health care provider to stitch your wound, but you find it difficult to find one. So where does that leave you? There's a number of things you can do. And again, the healthcare landscape is changing considerably right now. So it used to be, oh, you just go to your GP. Now you have to find a GP. And of course, we know maybe 25% of Canadians don't have a GP. But even those who have a GP may have a hard time accessing that GP. So for example, I've got a GP. I'm one of the lucky ones. But if I want to make an appointment, the first appointment that is available for me is normally about 3 months in the future, right? So if I've got a wound that needs suturing, that's not really helpful. And then there are all these other kinds of primary health care venues available. There's mobile vans, there's walk-in clinics, there's um, collaborative healthcare clinics, there's non-emergency urgent primary health care clinics. So all these new fangled different services are being set up. And of course, depending on your province, you may have access to a private clinic as well. So it depends on where you are. Usually in an urban setting, you have more options. It depends on what exactly your condition is. Do you want to get your earwax removed, in which case maybe you can wait for 3 months, or do you need a wound sutured, in which case you probably don't want to wait for 3 months? And of course, it also depends upon whether and the extent to which you are willing in lieu of going to your GP, to go to the emergency department and for essentially non-urgent care, and just sit there and wait. So a lot of, these different variables, you have to figure out exactly, what matters to you. Is it urgency? Is it cost? Is it the time you have available? Is it your principles? So on and so forth. So we are really making, as healthcare consumers, we really have to make a lot more decisions than we ever did in the past concerning our healthcare services.
Monday in Nanaimo, the Canadian Labour Congress was hosting this media availability near the hospital. They used the phrase like the Canadian healthcare system is crumbling. Is that a fair thing to say? Or when we talk about, the system in crisis, is that a reasonable summary?
Yes, I would say so. And now, if you look at healthcare systems around the world, all healthcare systems to a certain extent are facing the same kinds of pressures for the same kinds of reasons I noted earlier. And yet, I think in Canada, the situation is worse. There's a very large portion of the population who simply don't have access to primary care. And that's not true for a number of our comparator states, especially the European states. So, like I mentioned, several decades ago, I would not have had an issue accessing a GP within a few days. And now, like I said, even if you're lucky enough to have a GP, you're waiting an incredibly long period of time to see that GP. So primary health care is in a bit of a shambles. And then there's the issue of emergency times. Of course, emergency services across all the provinces are also under scrutiny because it takes so long to get access to an ambulance. And there have been well-publicized cases where the ambulances don't show up until it's just too late. And once you do actually get to an emergency location, you can be waiting. Again, I can remember going to emergency with my kids all the time a few decades ago when they were growing up. And I never had to wait. Every minute seems like an hour when you're with a sick kid, but I never had to wait for more than a couple hours. And the wait times now are just unbelievable. So there's that. And then there's wait times for surgeries. And surgery wait times have gone up. Wait times for diagnostics have gone up. So, there is this unfortunate situation where you want to be able to catch small things early because if you wait too long, then it's going to be quite difficult, quite costly to treat that if in fact you can still be treated. So the more it becomes, the more difficult it becomes to access care, the worse the outcomes may be in the long run. And that's really what we're facing right now.
It's a federal election campaign. Here in Nanaimo, a local media outlet, The Discourse, did a survey of like, what are your top issues this election? Healthcare was the most cited one. Have you been seeing the issue get enough oxygen on the campaign trail?
Well, what's really remarkable about healthcare in this election campaign is that it's been so unremarkable. Now, at one point, I tried to find the Liberals' election platform on healthcare, and I looked at it and I thought, oh, this is quite detailed. And I went through it, and then I realized this was a 2021 platform. And in fact, it's interesting looking at their 2021 platform vis-a-vis the current one because their previous platform was quite comprehensive and detailed compared to the current one, which is incredibly thin and largely just geared to maintaining the status quo, which again was itself largely established because of the prodding of the NDP. If you look at now, the Conservatives federally have never really had that much to say about healthcare, and in this election, they focused mainly on illegal drugs, largely because it resonates well with their base, but they don't really have much to say, as usual, about the broader healthcare system in general. The NDP have the most proactive and comprehensive healthcare plan including expanding pharmacare, prohibiting the American purchase of healthcare clinics, which is a very interesting and important topic. They've also put forward the proposal that they'd ensure that all Canadians have access to a family doctor by offering an additional 1% in Canada Health transfer funding to provinces that guarantee access to a family doctor, which is interesting because it really begins to show that the federal government is putting more emphasis on bilateral funding agreements rather than general transfer payments. But again, it raises a huge issue for the federal government, which is that the federal government has to be careful not to promote a race to the bottom by encouraging poaching, right? So if you incent provinces to make sure that they have more doctors, then of course a province with means is going to try to poach doctors from other provinces, which doesn't solve the problem, it just redistributes it, right? But in any case, because of the larger existential threat that we now face, obviously, the NDP's voice in this election is probably much more muted than it otherwise would be. Now, to be fair, the thing about the federal election is that exactly how healthcare is provided is, again, largely a provincial matter. So it's a tricky issue for the federal government. All they can really do is to provide more money for the system and to try to ensure that the money gets used for what they want it to be used for. A bigger strategy would be to try to rework the Canada Health Act to give it more clout. But again, how to do this is pretty complex. Now, interestingly, the Liberals said in their 2021 platform that they would address this, but the results to date have been pretty minimal. Though, again, it's just not something easily undertaken.
There's been a lot of talk in the last few months about interprovincial barriers. And you touched on, the potential for like a race to the bottom of one province poaching healthcare staff from another. I'm wondering if you could tell me maybe about the way there are interprovincial barriers in our healthcare system right now and what the impacts are.
There's all sorts of barriers. The movement of healthcare professionals is just one of them. Another one is the use from the federal perspective, the fact that it's quite difficult to get the kind of data that they need in order to understand what's going on in all of the provinces. And another problem, it's not really a barrier, but the way that the Canada Health Act is set up is that, again, it only addresses insured services for insured people. And in BC, if you're not a BC resident, you're not an insured person for the purposes of BC health insurance. So what this has meant is that if I live in Alberta and I want to get a hip replacement, then I can go to BC and easily get this care privately because in BC it's quite legal and quite more or less legally acceptable to set up a private clinic only addressing the needs of uninsured individuals. And by definition, anybody who is not a BC resident is an uninsured individual. And the same is true in Alberta, that you have clinics in Alberta, private clinics that are set up for hip replacements, knee replacements, cataract surgery, the fairly, in and out, fairly quick and dirty kinds of surgery. And so you have a lot of cross-border traffic who are accessing this, which again is another level of, if you will, another form of two-tier healthcare that is really burgeoning. But again, because of the way that the Canada Health Act sets out what provinces can and cannot do, this is completely acceptable. Whether it's politically acceptable, of course, to the voters themselves is a completely different issue.
I can certainly remember when I was younger, it almost being a kind of a cliche that well-to-do people would go to the United States and receive whatever treatment privately. And, if said well-to-do person was a politician, it could cause a bit of a scandal. That kind of thing is just regularly happening more and more so just even within Canada. If I want a hip replacement or a knee replacement, presumably I would be on a months to years long waiting list. But if I hop on a plane to another province and have a few tens of thousands of dollars, I can just get that done.
Yep, that's it in a nutshell.
Is anyone talking about that?
Yeah, there's a lot, I assume, going on behind closed doors. There's a lot of discussion happening between the provincial and federal governments. I've tried to access some of this information through Freedom of Information Act, and of course, what you get is just so heavily censored that it's not useful. But by the pages of censored documents that you get, that there's a lot being discussed. But again, it's completely behind closed doors. So, for example, in 2018, Ottawa introduced what's called the Diagnostic Services Act, and they essentially said that medically necessary diagnostic services should be covered by provincial governments. And in fact, in most provinces, you can go and get an MRI or CT scan or an ultrasound out of pocket if you want, right? That's another form of two-tier healthcare in Canada. And Ottawa said this is unacceptable, and provinces have essentially said, yeah, we don't care. Now, certain provinces, to certain extents, have addressed this, and you can look up um, over a year ago now, in March 2024, Ottawa Health Canada explained the kinds of penalties that it had levied on the provinces for violating the Diagnostic Services Act. So provinces are just swallowing this. They are not cooperating fully, and they've had to pay back some of the federal health funds because of this. But we don't know what the current situation is. Now, I was expecting to see more information in March of this year, March 2025, from the federal government explaining what the situation was in terms of the fines levied for the various provinces for violating the Canada Health Act, and it hasn't come out. This is quite a remarkable delay. So it could be because of the election call, but again, if it comes out every year, I don't see why this should be affected by the caretaker provision. So I'm sure that it's been quite a difficult foray for the federal government to try to put together the current Canada Health Act report because so much is going on and there's probably such a lot of discussion between provinces on this point. But the silence itself speaks volumes.
This week, the federal leaders' debates are happening in English, in French. There are 5 themes for each of those debates. Healthcare isn't one of them. What do you make of that?
Well, again, if it weren't for Mr. Trump, I think healthcare would be on the agenda. But it gets back to this, completely rational fear of what the heck is going to happen to our country, what's going to happen with our finances. And it's not at all unreasonable for people to focus on that topic front and center. But again, the healthcare issues that we discussed are not going to go away. And people are putting a lot of trust that these issues will be dealt with without any upfront promises from any party going forward. Essentially all we've heard is that if the Liberals get in, it'll be pretty much a status quo, don't worry. Although the status quo itself is quite worrisome. And if the Conservatives come in, then traditionally the conservative position is, well, we'll give money to the provinces. How they use it is up to them. We're not a nanny. We're not going to check up on them. And in that case, I presume that you probably could see a lot more tolerance for the expansion, the quiet expansion of privatization in Canada, to the extent that it doesn't directly violate the Canada Health Act.
I wanted to give at least a cursory discussion of spending in the healthcare system this year. According to the Canadian Institute of Health Information, it's estimated to represent 12.5% of Canada's GDP. I've seen figures from them projecting that it means we spend about $9,000 per Canadian this year in our system. Is there any kind of context you think people need to know if they're thinking about, I don't know, this is how much the system is costing us versus how much we're getting out of it?
Well, I mean, the bottom line is that the money has to come from somewhere. The tricky aspect of Canadian healthcare is that it's great, but it costs a lot. Now, the one thing that really separates Canada from a lot of comparator countries is that we tend to go narrow but deep. In other words, we only guarantee public insurance of a few things, essentially primary care and hospital care, but we will pay 100% of those. In other countries, such as France or Germany or the Netherlands, which have really good healthcare systems, actually, they'll say, we'll pay between 60 to 80% of your primary care or your hospital care, but we'll also pay 60 to 80% of your pharmaceuticals, of your dental care, of your eye care, of your physiotherapy, et cetera, et cetera, et cetera, right? So they cover a lot more, but they don't necessarily cover as much. So what happens is that Canadians pay more out of pocket for things that are not insured, but are actually fairly important for their health or even to stay alive. So, drugs being the best example. We barely have any pharmacare. The pharmacare that we have is incredibly minimal, but we do have some pharmacare now. But so people pay a lot of money either out of pocket for drugs that they need, or they pay out of pocket for private insurance, which will then cover some or all of their drug costs. I certainly could not function without a sturdy pair of glasses, which will cost me a good $1,400. And again, this is either paid for out of pocket or through private insurance. And in other countries, again, at least a portion of this would be covered. Which is to say that if we want our healthcare to do what we want it to do, to be both, comprehensive and equitable, because, some people, if you're lucky, you end up with something that can be treated in a hospital, you're not liable for the cost. If you're not lucky, then you have a condition where you have to go pay for drugs. You take the drugs at home and it's not going to be covered again unless you have insurance or unless your province decides to pony up for it. So if we want a better healthcare system, then we need more money going into that system. Where is that money going to come from? So the financial question that you mentioned is really quite important. So do we pay more in taxes? Well, that's how Canadian healthcare has generally been financed, and some other systems like the British system uses that as well. But the problem, as you know, is that people don't like paying higher taxes. Now, if you go back to the Hall report that was written in about 1962, 63, it says that, well, we believe in public health insurance, and we're going through a period of economic growth, and we believe that this period of economic growth will allow us to cover the costs of healthcare, which was fine in the early 60s. I mean, there's a lot of debate about that at the time, but that was the mindset that, the good economic conditions will cover these costs so that we can take this route. We really don't see things that way anymore, especially here and now. So, increasing taxes is really the third rail. Touch it and you die. Try to put higher taxes on your election platform and see how far that's going to get you. So if we don't go for higher taxes, then fine, how do we get the kind of healthcare that we need? And that's the dilemma.
Catherine Frobeck is a professor of political science specializing in health policy at Dalhousie University. That's our show for the day. Thank you for joining me. I'm Joe Pugh, host and producer of Midcoast Morning. Jesse Woodward is our executive producer, and RB Fruit is our technical advisor. You can sign up for CHLY's newsletter at chly.ca/subscribe. If you have a story you'd like us to cover, email us at news@chly.ca. Our theme song is First One by local Nanaimo band Waste Management. That's all for now. I'll talk to you on another Midcoast Morning.
Midcoast Morning would not be possible without the funding of the Community Radio Fund of Canada's Radio Meters program and listeners like you. Midcoast Morning is a project of CHLY's nonprofit newsroom. Support nonprofit journalism in Nanaimo and on the Salish Sea today by becoming a monthly sustaining donor at $5 or more per month. Support the program at chly.ca/donate. If you're already a supporter, record a voice memo telling others where you're listening from and why they too should support our work. After you're done, you can email it to us. Also, share the podcast with your friends. While Meta is blocking Canadian users from sharing news content on their Facebook feeds, you can still share our podcast directly with your friends via Facebook or Instagram Messenger. Finally, this program acknowledges and gives thanks to the Nanaimo First Nation as we broadcast and podcast from their traditional territory. Thanks for listening.